I'd like to provide you with an overview of the LP4 course segment. As is the norm, I'll start out by considering the assignments for the course and then consider some of the LP4 course segment topics. With regard to assignments, again, initial replies to the discussion questions are due as is typical at the end of the first week of the course segment. Participation replies need to be made at the end of the second week of the LP4 course segment. Please refer to the course expectations announcement for the specific dates associated with this for this particular course. Turning now to the LP4 assignment itself, the focus this week will be on writing a 5 to 6 page paper. As is typical, the cover page and references don't count for the page count requirement. It needs to be written, properly cited in APA citation style and format, and it needs to include at least 3 peer-reviewed references. And again, I underscore the fact that these need to be journal-based, web-based references. If they're not linking to a journal, would not be considered appropriate to fulfill this assignment criterion. The assignment itself should focus on analysis and evaluation of the impact that health education has provided by relief and non-governmental organizations in countries which are undeveloped. Consider the following 4 areas of focus when you're compiling content for the paper. How the issues we've talked about so far have impacted these types of initiatives, what the major initiatives conducted by these agencies are, how effective they've been, and how these organizations impact U.S. health. My suggestion as you evolve content for the paper is to consider breaking down the paper into individual sections that will better allow the reader to focus on the points that you're going to consider. Start out the paper with an overall introduction defining the topics that you'll consider. Consider these particular 4 points, and I think from again a structure standpoint, I have sections that are devoted to each of these particular points. And then be sure to include a conclusion section or summary section that ties the information together for the reader. The due date for this particular assignment is the last day of the LP4 course segment. Turning now to the topics in this particular section, the focus really here is on the key competency, and the content of that is an evaluation of the international nonprofit and non-governmental organizations, also known as NGOs, to identify, educate, and intervene in global health care. Consideration of the roles, impact, and success of these particular types of organizations. So the primary focus for my comments regarding the LP4 course segment topics are really going to focus on non-governmental organizations overall. The text considers this, but I suggest you avail yourself of online resources, and some of the content in the text, at least from my cursory look at it in preparation for this overview, is really not necessarily as in-depth as one might particularly like. So my suggestion here is avail yourself of some of the web-based resources that you're able to identify. The term non-governmental organizations isn't always used consistently, and in many respects, NGOs can be difficult to define and also to classify. Because of this, there are really a variety of different types of classifications that are in use. The most common one basically entails a focus on orientation and level of operation per se. If you look at the earliest times that NGOs were really mentioned from a historical perspective, they date back to involving the United Nations at the time that was created back in the 1940s. One particular trait or characteristic that these organizations share is that they typically have a nonprofit status. And that means they are not really driven or constrained in many respects by financial objectives or obligations in that regard. Basically, they try to devote themselves to the issues that occur which have longer time horizons. such as malaria prevention or global bans on landmines. Many of them are involved in altruistic or certainly charitable types of areas of focus. And when you look at the reaction of the public to these particular types of organizations, they basically are associated with a lot of public trust in them. And this can be a very useful type of tool to basically serve as a proxy to represent effectively the concerns of a variety of different stakeholders, societies, government groups, as well as special interest groups. What I'd like to turn now to is just a series of comments, I think, on non-governmental organizations and their role in the healthcare sector. I mean, NGOs really have an important place to play in society, and where concerning people are essentially involved without any desires for personal gain. So as I mentioned before, the focus of the NGOs is really very much altruistic. There are numerous NGOs working in different parts of a variety of different third world countries, and the health sector overall needs a large amount of support, provides a large amount of support for them. NGOs are really most helpful in cases where there's an earthquake or a flood, because general citizens really need help in the first few hours of the disaster. Not only this, but the government can take help in many social awareness programs like polio eradication in India, which have also proved to be very successful in that regard. When you give some consideration to how you facilitate the NGO vision overall, they also seek financial sustainability. This is particularly important because in many respects that's really involved with their ability to continue the type of work that their mission and focus entails. So the government or international bodies like the World Bank can help to provide financial sustainability. The need for non-governmental organizations also comes into the picture because of oftentimes what you might consider to be lethargic attitude on the part of government bodies and bureaucracy behind the curtain of those particular bodies. So that's an important point to consider as well. The distribution of basic health, basic medicine can also be done through selective non-governmental organizations, which often have a focus on a variety of different regions of the world, or sometimes regions of a country. There are innovative NGOs in a variety of different countries which have come with the concept essentially of providing mobile health care. And this is an important point of note just because of the fact that oftentimes infrastructure, as I mentioned in previous comments in prior LP segment overviews, sometimes can be compromised in third world countries. When they apply this concept, they visit different rural areas where government health care is very rare or difficult to get or be provided. And they also provide basic medicine and first aid to the poor and needy individuals in that particular part of the country. So when you look at the major sources of funding for NGOs working in the healthcare sector, these include user fees, prepayment or insurance schemes, national government support, commercial schemes which involve income generating activities, fundraising activities and private donations, endowments, contributions by employers or scientific or medical associations, and savings through cost containment measures and efficiency improvements. They also can involve international donor support as well. So when you look at just allowing private bodies to the healthcare sector doesn't always lower the accountability of the government in terms of their role, because private bodies like NGOs have an attitude where they basically can secure maximum return, helping to contribute to their core mission. To provide better service to the people, therefore, legal restrictions come into the picture because health is really a matter of life and death in that regard. These are some general considerations to kind of bear in mind with respect to non-governmental organizations overall. As I mentioned before, NGOs really came into being around the same time that the United Nations did, which was in the mid-1940s. The UN essentially is an intergovernmental organization, and it's made possible for certain approved international non-state agencies, or NGOs essentially, to earn the status of observer status as assemblies and some of its meetings. Later the term became used more widely. And today, according to the United Nations, any type of NGO or private organization that's independent from government control can be linked with the term NGO, provided it's not for profit, is not simply an opposition political party, and isn't involved in any type of criminal activities at all in that regard. One point I'd like to mention, even though my initial comments had focused on the general category of health and involvement of NGOs in that area, is that NGOs can really focus on a variety of different fields. And typically these are relating to social causes or scenarios or situations that might result in improvement of quality of life. So they're humanitarian focus, emergency medical type of focus. These can involve both international and local organizations, and many are associated with international aid and also voluntary donations on the part of donors. But there are also NGOs that choose not to take funds from any of these groups or individuals and try to essentially generate funding in other ways, such as providing sale of items which are handmade, or basically providing some type of cost associated with their services. Another example of a category of NGO essentially is those that are focused on the environment. Examples here would include Greenpeace, which is certainly, I think, a prime example. There are also transnational environmentally focused non-governmental organizations that advocate for lots of different issues like public goods, focusing on pollution in the air, or water quality, or water pollution, and issues relating to deforestation. So it's more difficult for them to really give their campaigns a human face when their focus is really on other types of issues. There are a variety of different types of methods that NGOs can utilize, it's important to remember that tactics and strategy are sometimes very much interlinked. Some can act primarily in the role of lobbyists to basically influence special interest groups, while others are actively involved in conducting programs and activities. So, groups such as, let's say, for instance, Oxfam, which is focused on poverty alleviation, really helps to provide individuals who are in need with skills and equipment in order to basically facilitate their ability to locate food and clean drinking water. In some respects, you might look at non-governmental organizations to fulfill a role in basically filling a gap or bridging a gap that classical government services are not providing. But in countries like India and China, for example, non-governmental organizations are really gaining a position at the decision-making table overall. In India, for instance, non-governmental organizations are underregulated, they're political, and they're also recipients of substantial government and international donor funds. They also take up responsibilities outside their core area of skill focus. So governments have no access to numbers of projects or amount of funding received by these NGOs. So there's a pressing need to regulate this group while not curtailing their unique role as a supplement or a group that's basically supplementing government services. In many respects, it's of value to governments to really partner with these types of groups because a lot of the benefits that they're bringing to the table are in many respects going to supplement core government resources and core government contributions, and in so doing, they will basically help to fill some of the gaps that these underdeveloped nations may have from a governmental standpoint in terms of service provision. Governments, not governments, but NGOs essentially can be large or small, and they will entail a variety of different types of budget levels in order to maintain their operations. For instance, large NGOs can have annual budgets in excess of hundreds of millions or even billions of dollars, and that's an important point to consider. So their funding level can be fairly substantial. There's also the issue of NGOs being an essential employer in terms of numbers. So, for instance, if you look at Concern Worldwide, they basically are working with the focus on poverty. They employ 174 expatriates and over 5,000 national staff working in 10 developing countries in Africa, Asia, and Haiti. This is a point of consideration sometimes for countries, because the pay scale for for individuals who are working for these agencies can oftentimes be substantially greater than the same role would be compensated for in that particular country. For all the benefit that NGOs can actually bring to the table, there have also been some challenges to their legitimate focus, their legal status, also sometimes critiques of some of the areas of focus that they're involved with. However, even in view of that, I think it's important to recognize the fact that they play a fairly significant role in the global stage. What could probably be a benefit moving forward is some level of integration and cooperation across the various non-governmental organizations to basically maybe pool resources along the lines of common areas of focus, facilitate the benefits that collaboration can actually bring to achieving success with regard to some of the areas of focus that these groups are involved in. And I think in the balance, it might also take a scenario where you may have limited funds in one or several NGOs, which, if pulled together, may actually form a critical mass of both support from a financial standpoint, resources, as well as human capital, which can be tasked against a particular project. So they play a significant role on the international stage, and I think as healthcare has become much more global, there'll be a lot of benefit to helping facilitate the inter-organizational collaborations that might actually facilitate and optimize some of the outcomes that they're all individually working toward achieving. So those are some of the comments which I wanted to share with you, concerning NGOs. I appreciate your attention, and please, if you have any questions concerning the LP4 segment, please feel free to get in touch with me. Appreciate your attention.